Thank you, Chair.
Thank you.
And thank you to the people, Solidarity People Before Profit, for having this bill on the floor today. But when it comes to the COVID-19 responses, we as a people wear masks, we wash our hands, we social distance, abide by complete lockdowns. We've even paid for €9 meals, endured hotel quarantine, and largely took vaccinations, applied and used vaccine passports, and yet we are where we are. We need to look at other solutions rather than extending the failed ones. We now know that we have an airborne virus, yet none of the focus of our COVID response has been on improving air quality or air filtration. Why do we need a bill for this? I received an email last week whilst I was actually visiting a primary school, where a primary school principal which outlined the current situation very well. I just walked past 4th class, sitting in a room of barely 40 square metres, windows open, radiators hopping off the wall, children wrapped up in coats, hats and scarves. The temperature in this room, 13.7 degrees. Surely we have to look at HEPA filters as a solution. Our Board of Management is very eager to purchase, but the cost is a major problem. Please make representations on our behalf. Our children are going to have a miserable experience of school if we do not act quickly. December, January and February are going to be carnage at this rate. In researching the topic of air filtration, I came across a study published on September the 22nd of this year. It investigated the removal of airborne SARS-CoV-2 and other microbial bioaerosols by air filtration on COVID-19 surge units. It is worth noting that this study has yet to be peer-reviewed, but I do believe its findings are worth exploring for application in both our healthcare and education settings. The researchers conducted a crossover study of portable air filtration and sterilisation devices in a pre-purposed surge COVID ward and surge ICU. They found that airborne SARS-CoV-2 was detected in the ward on all 5 days before activation of air/UV filtration, but on none of the 5 days where the air/UV filters was operational. SARS-CoV-2 was again detected on 4 out of the 5 days when the filter was off. They concluded that these data demonstrate the feasibility of removing SARS-CoV-2 from the air of purposed surge wards and suggest that air filtration devices may help reduce the risk of hospital-acquired SARS-CoV-2. All of the money spent during the course of the government's response to dealing with the spread of an airborne virus, surely now one obvious place to direct our attention would be at improving air quality. It is but one measure of many choices not taken by this government that could help. In general, the government's approach to schools has been completely hypocritical. On November the 16th, the Taoiseach said, and I quote, "Public health advice has been consistent from the get-go that schools are safe places." That statement to a complete U-turn last night, just 2 weeks later, when the Taoiseach said, "COVID in schools has gone through the roof." Based on this alone, I believe an apology should be extended to the principal of CBS Primary School in Wexford, Miss Vicky Byrne, for her and the Board of Management's proactive approach. We need to consider better alternatives than having students and teachers sitting in the freezing cold during winter, in danger of catching pneumonia, never mind COVID. The need to introduce air filtration measures is obvious. Why has it taken so long to reach this point? Why now are we instead putting the burden of mask wearing on small children, when government should be providing the funds to all schools and hospitals to instead install HEPA filtration systems so as to serve and prepare for the 5th inevitable surge of this virus in the future? In the same way, antigen testing should also have been rolled out a long time ago, and it should be free for everyone, in which case it couldn't be abused. Yesterday, I received a message from an in-house residential carer who is spending €25 a week herself on antigen tests. How many will do this? Not many. And surely, Cathaoirleach, we've spent 80-odd million on ventilators that we got no benefit from. There is a benefit in rolling out antigen tests, but the government is choosing to be pound foolish and penny wise, a decision we as a nation will live to regret. Following on from the total delay in acknowledging antigen tests and using them as part of the armoury to fight this virus, government now says that in order to enter the country, you must have a clear PCR test 72 hours in advance and a lab-conducted antigen test 48 hours in advance of arriving on this island. However, an assistant virologist at UCD, Dr. Gerald Barry, this morning on the national airwaves, says this is a pointless exercise and is just window dressing. He says the intention behind the antigen testing before flights is correct, but the manner in which it's being done will not achieve the aim. He says it's completely pointless to carry out an antigen test 48 hours in advance of travelling, as a one-off test does not identify the virus, and that a PCR is probably better, but 72 hours in advance is too long a window. He says there must be a greater emphasis on controlling the disease. Dr. Barry says we need to dramatically ramp up our testing and tracing system to detect new cases and rapidly clamp down on them. This is not new. This is something that has been said by many, many opposition TDs on the floor of this House for the past 18 months, but it is not happening. However, I'm pretty sure we won't hear from Dr. Barry anytime soon, as has been the case with other eminent medics with alternative views. Inserting proper filtration in schools is also not new. It was what government said it was looking into, and surely it is a more effective policy and far less divisive than forcing children to wear masks all day in school. Not to mention that the fact that it only applies to half the classroom if some of those children are not yet 9 years old. And finally, Chair, government cannot continue to say that we as a people, having returned to some semblance of normality in social interaction, is the reason for why we are now having to endure more and more restrictions. Government needs to put its hands up and say that we were wrong to remove contact tracing in schools. We were wrong to ensure that the capacity was there for test, trace, and wasn't there for test, trace and isolate as the best measure to contain the spread. Government are wrong not to increase the ICU capacity to what's required to prevent further restrictions and lockdowns. And in being wrong, they need the help of the people to get it right. And based on yesterday's new travel requirements, they can hold their hands up and explain why an antigen test is sufficient to gain entry into this country by proving your COVID status and not a vaccine status, but isn't apparently sufficient to gain entry to a restaurant or any indoor setting deemed high risk. Thank you, Chair.
Thanks.